Hello and welcome to my channel. In this lecture, we're going to continue our talk about the female reproductive system. So let's begin. Now we've studied the ovaries and the uterine tubes. Now we are going to study the uterus. It's a hollow, thick-walled muscular organ lying totally in the true pelvis, means below the pelvic brim. Of course, this is before any pregnancy occurs because after delivery or after any pregnancy, the uterus changes its size and position. The urinary bladder in front of it and the sigmoid and rectum are posterior. In nulli gravida means that didn't get pregnant before, not didn't give birth before, didn't get pregnant before. It's flat and pyriform in shape. On the outer side, there is a constriction at the surface that marks the level of the internal os. The internal os is the upper opening of the cervical canal, where the uterus changes from cervix to corpus uteri. It represents itself by a constriction on the surface, and the uterus, of course, receives the tubes and opens into the vagina, and the part above the tubal opening, this part is called the fundus of the uterus. So parts of the uterus are the fundus, the corpus uteri, and the cervix. Okay? And of course the uterine tubes. The body, or the corpus uteri, it's pyriform in shape and gradually narrows from fundus to internal os. Anteriorly, it's covered by peritoneum reflected on the superior border of the urinary bladder. This reflection is at the level of the internal os. Posteriorly is covered by peritoneum but reflected from the upper vagina. Okay. The urinary bladder lies anterior, and posterior there's the rectum, sigmoid, and coils of ileum. Not posterior, posterior superior actually, and the lateral sides receives the tubes, the round ligament of uterus and the round ligament of ovaries. We've talked about these before. The round ligament of uterus and the round ligament of ovary are continuous, and they are the remnant of the gubernaculum, the one that pulled the testis in the male downwards in the scrotum. The cervix of the uterus is cylindrical. The cervical canal is widest at the mid-level, and it inserts in the anterior wall of the vagina. Please observe, inserts into the anterior wall of vagina, not the apex of the vagina, anterior wall of vagina. And because of this insertion, it forms a fornix surrounding it. And to describe the fornix, it's divided into superior fornix, inferior fornix, and lateral fornices. Okay. See, this is here the posterior fornix here, and this is anterior fornix. I mean, the groove that surrounds the cervix when inserted into the anterior vaginal wall. Now, because of that, the cervix is divided into vaginal part. See this part, and a supravaginal part. Vaginal part and supravaginal part. The supravaginal part has the urinary bladder anteriorly and separated by peritoneum from it, with the reflection of the uterovesical pouch. Posteriorly, it's covered by peritoneum reflected from the upper vagina as the rectovesical pouch. The vaginal part, the cervix almost touches the posterior wall of the vagina. It's in the anterior vaginal wall and opens into the vagina by the external os which is pinpoint in nullipara. Nullipara means they didn't give labor before. They didn't give labor before. Nullipara, it's pinpoint, but in Paris women, it has lips, anterior and posterior lips, because of the previous dilation and stress on the cervix during delivery. This is the vaginal part. The uterine cavity, this is the uterus specimen, cut coronal section to show you the uterine cavity. See, the uterine cavity is triangular in shape, opens superiorly in the uterine tubes, and inferiorly it opens into the cervical canal by the internal os, and the cervical canal opens into the vagina by the external os. And as you can see here, the cervical canal is widest in the middle. Now, as natural defense, the cervix is plugged by a mucus plug. It becomes very thick in pregnancy. And also there are ridges in the walls of the cervix called the palmate folds. It's like the palm leaves, and they ascend laterally, interdigitate to close the canal. So remember the ridges in the cervical canal. This is a hysterosalpingogram where a dye is introduced into the vagina and into the uterus to show you the uterine cavity. See, this is the uterine cavity and this is the cervical canal, and spillage of the dye from the uterine tubes at the ovary, sites of the ovaries. See that? This is a hysterosalpingogram technique to visualize the cavity of the uterus. Now, the upper third of the cervix, it's called the lower uterine segment or the isthmus. It differs from the rest of the uterine wall in ways that it's taken up into the body by the second month of pregnancy, taken up into the body because the uterus is expanding. It's not attached to the fetal membranes like the rest of the uterus. So that it does not form a stress on the fetal membranes and tears it. Dilates in labor. The uterus constricts in labor. This segment dilates in labor and shows cyclic menstrual changes in the non-pregnant woman. And the mucosa is thinner and has fewer glands than the cervical mucosa, the glands that's present in the cervix. So these are very important differences between the lower uterine segment or the isthmus or the upper part of the cervical canal from the rest of the uterus. You should be aware of these differences. It's a good it's good multiple choice questions here in this area. Now, for the position of the uterus, we have two axes. See, this is the axis of the vagina, this is the axis of the cervix, and this is the axis of the body. We use two angles between two axes. The angle between the axis of the vagina and the axis of the cervix, this is the angle of anteversion. Anti with an E means forward. It's forward, thrown forward, okay, on the vagina, relative to the vagina. See the angle between the axis of vagina and the axis of the cervix. Now there's another angle between the axis of the cervix and the axis of the body. See that? This angle. We talked about this angle, now it's this angle. This is called the angle of anteflexion. Means the uterus is flexed on itself forward. So the normal position or the normal axis of the uterus is anteverted, anteflexed, and obstetricians call it anteverted flexed. There are variations in the position of the uterus. Of course, the common is retroverted. Retroverted means directed backwards. This results in compression or pressure on the sacral nerves, and continuous pain like sciatica pain in females who have anteverted, retroverted, retroflexed uterus. Also, in females with retroverted, retroflexed uterus, they suffer in pregnancy because the uterus is directed backwards, so it pressures on the inferior vena cava, so they have to sleep on their sides all the time to prevent the pressure of the inferior vena cava. Now, the treatment for the retroverted, retroflexed in females is simply to get pregnant, because the uterus will change its position and size and will not pressure the sacral nerves any more. Now, there is a case called the subinvolution of the uterus, in which the uterus does not return into its regular or original size and shape before pregnancy. Usually it does not, but I mean in an exaggerated way. This is called the subinvolution of the uterus. And there is also the case of prolapse, in which the uterus goes down and may protrude outwards from the vagina. It pulls with it the urinary bladder as vasicocele, or the rectum as rectocele. It's an ugly scene to see a uterine prolapse. I've seen it before. And it's a common problem in females who had multiple pregnancies. Leads to weakening of the uterine ligaments that holds it in place. The uterine structure, there are different terms. Perimetrium. The perimetrium is the serous membrane, peritoneum, covering the uterus. Myometrium is the muscle wall itself. Endometrium is the mucosa. See, this is endometrium. This is myometrium. Parametrium is at the base of the broad ligament connective tissue that extends laterally and forwards between it and the urinary bladder. And it has the ureter and the uterine artery in it. And you get access to it through vaginal hysterectomy from the fornix, lateral fornices, when you cut and ligate the uterine artery, and be careful not to ligate the ureter with it in the parametrium. The uterine ligaments, there are physical ligaments and there are only folds. Like the anterior ligament is the uterovesical fold. Posterior ligament is the rectovaginal fold. Uterosacral ligaments are folds that extends back to the sacrum, and there can be palpated laterally in digital rectal examination. Also, we have the round ligament of uterus, and we've talked about this before. It's the remnant of the gubernaculum together with the round ligament of the ovary, and it courses. This is the round ligament of the uterus. See, it enters the inguinal canal through the deep ring, courses like the spermatic cord, like the vas deferens, and ends by attaching itself to the back of the labia majora. Transverse cervical ligament of Mackenroth. This is called the Cardinal ligament. It's from the cervix and vaginal vault and fornices extending laterally to the fibrous tissue around the pelvic vessels, and it's important in maintaining the position of the uterus. Of course, you can't see it here. And the broad ligaments. The broad ligaments are peritoneal folds that covers the uterus and the sides. It's prominent at the side of the uterus, of course. Forms like a septum in the pelvis. In full bladder, it's anterior and posterior surfaces, and in empty bladder is superior and inferior surfaces. Has a free border, see that contains the uterine tubes. And the infundibulum of the uterine tube emerges from its lateral side, and the base is at the reflection of the two layers of the broad ligament, one anterior and one posterior, one to form the uterovesical pouch and one to form the recto-uterine pouch. The contents of the broad ligaments Of course, the tubes, the mesosalpinx, the mesentery of the tube, the mesovarium, the mesentery of the ovary, the vestigial structures from the atrophied mesonephric duct, which are the epiophoron and paraophoron, areolar tissue. The rest of the broad ligament is called the mesometrium. Okay, it has the proximal parts of the round ligament, and it has the round ligament of uterus, and it has the round ligament of ovary, and the suspensory ligament of the ovary carrying the blood vessels to the ovary. All these are structures within the two layers of the broad ligament. And remember that the ovary extends from the posterior layer, means that the mesovarium is attached to the posterior layer of the broad ligament. The blood supply of the uterus, very rich in blood supply, of course from the uterine artery that comes from the internal iliac artery. Uterine artery enters between the two layers of the broad ligament and gives branches to the uterus as it ascends at the sides of the uterus. These branches are called the Helicine arteries. Helicine arteries, they are helical in shape, and their tips shows periodic changes, atrophy and hypertrophy with the endometrial cycle. The uterine artery ends by joining the ovarian artery, and the venous drainage, of course, follows the arteries. So it is the uterine artery, the main supply of the uterus. Lymphatics of the uterus. Now this is important. The fundus and the upper body drain into the aortic lymph nodes along the ovarian vessels. The lower body to the external iliac lymph nodes. The cervix to internal iliac lymph nodes, okay, along the sacrogenital folds. The superolateral angle, remember we talked about the round ligament of uterus, and there is a branch from the ovarian artery to the round ligament of uterus along which lymphatics go. So from the superolateral angle, lymphatics go to the superficial inguinal lymph nodes along the branch to the round ligament of the uterus. The nerve supply of the uterus mainly sympathetic, and the pain elicited from the cervix is only elicited by dilation. You can cauterize a female cervix without the female feeling any pain, and you will do this in obstetrics and gynae, cauterization of the cervix. So the only stimulus for pain in the cervix is dilation. These are the labor pains. Okay, so this concludes the female reproductive system. I hope you got the maximum benefit from this lecture, and thank you very much for watching.